manufacture and deployment of our vaccines against COVID-19. It represents, Madam Deputy Speaker, a staging post in our national mission to vaccinate against the coronavirus, and a culmination of many months of hard work from the NHS, our armed forces, Public Health England, and every level of local government in our union. There are many miles to go on this journey, Madam Deputy Speaker, but armed with this plan, our direction of travel is clear, and we should be buoyed by the progress we're already making. As of today, Madam Deputy Speaker, in England, 2.33 million vaccinations have been given, with 1.96 million receiving their first dose and 374,613 having already received both doses. We're on track to deliver our commitment of offering a first vaccine to everyone in the most vulnerable groups by the middle of next month. Groups, it is worth reminding ourselves, Madam Deputy Speaker, that account for more than 4 out of every 5 fatalities from the COVID virus, or some 88% of deaths. But of course, this is a delivery plan for everyone, a plan that will see us vaccinate all adults by the autumn in what is the largest programme of vaccination of its kind in British history. Madam Deputy Speaker, the UK Vaccines Delivery Plan sets out how we can achieve that noble and necessary and urgent goal. The plan rests on 4 key pillars: supply, prioritisation, places, and people. Turning to supply, our approach to vaccines has been to move fast and move early. We had already been heavily investing in the development of new vaccines since 2016, including funding a vaccine against another coronavirus, the Middle East Respiratory Syndrome, MERS. At the start of this year, this technology was rapidly repurposed to develop a vaccine for COVID-19. And in April, we provided £20 million of further funding so that the Oxford clinical trials could commence immediately. Today, Madam Deputy Speaker, we are the first country to buy, authorise and use that vaccine. Also in April, we established the UK Government's Vaccine Task Force, or VTF for short. And since then, they have worked relentlessly to build a wide portfolio of different types of vaccine, signing early deals with the most promising prospects. It's a strategy that has really paid off. As of today, we've secured access to 367 million doses from 7 vaccine developers with 4 different vaccine types, including the Pfizer-BioNTech vaccine, which we were also the first in the world to buy, authorise and use. The VTF has also worked on our homegrown manufacturing capability, including what is referred to as fill and finish process in collaboration with Wockhardt in Wrexham. Anticipating a potential global shortage early on, we reserved manufacturing capacity to allow for the supply of multiple vaccines to the United Kingdom. Like many capabilities in this pandemic, it's one we've never had before, but one we can draw on today. So much of that critical work undertaken early, Madam Deputy Speaker, has placed us in a strong position for the weeks and months ahead. The second pillar of our plan is prioritisation. As I set out earlier, essential work to protect those of the greatest clinical risk is already well underway, because the basic principle that sits behind all of this, Madam Deputy Speaker, is to save as many lives as possible, as quickly as possible. In addition, we're working at speed to protect staff in our health and social care system. All 4 UK chief medical officers agree with the recommendation of the Joint Committee on Vaccination and Immunisation, the JCVI, to prioritise the first doses for as many people on the priority list as possible and administer second doses towards the end of the recommended vaccine dosing schedule of 12 weeks. This step will ensure the protection of the greatest number of at-risk people in the shortest possible time. Madam Deputy Speaker, the third pillar of our plan is places. As of yesterday, across the United Kingdom, we have over 2,700 vaccination sites up and running. There are three types of sites. The first, large vaccination centres that use big venues like football stadia, and you saw many of those launch today. At these, people will be able to get appointments using our national booking service. The second type is our hospital hubs working with NHS trusts across the country. And the third is our local vaccination services, and they are made up of sites led by GPs working in partnership with primary care trusts and, importantly, community pharmacies. This mix of different types of site offers the flexibility we need to reach many different and diverse groups and, importantly, be able to target as accurately as we can. By the end of January, everyone will be within 10 miles of a vaccination site. And in a small number of highly rural areas, Madam Deputy Speaker, the vaccination centre will be a mobile unit. It bears repeating, Madam Deputy Speaker, that when it is their turn, we want as many people as possible to take up the offer of a vaccine against COVID-19. The fourth and final pillar is, of course, our people. I'm grateful to the many thousands who've joined this mission, this national mission. We now have a workforce of some 80,000 people ready to be deployed across the country. This includes, of course, staff currently working within the NHS, but also includes volunteers through the NHS Bring Back scheme, such as St John's Ambulance, independent nurses, and occupational health service providers. And there are similar schemes across the devolved administrations, as well as trained vaccinators. Non-clinical support staff such as stewards, first aiders, administrators and logistics support will play their part. Moreover, we're drawing on the expertise of our UK armed forces, whose operational techniques we heard Brigadier Phil Prosser bring to life at the press conference a few days ago with the Prime Minister, have been tried and tested in some of the toughest conditions imaginable. I'm sure the whole House will join me in thanking everyone who's played their part in getting us to this point, as well as all those who will play an important role in the weeks and months ahead. Madam Deputy Speaker, we recognise that transparency about our vaccine plan will be central to maintaining public trust, and we are committed to publishing clear and simple updates. Since the 24th of December, we have published weekly UK-wide data on the total number of vaccinations and the breakdown between over and under 80s for England. From today, we are publishing daily data for England, showing the total number vaccinated to date, and the first daily publication was this afternoon. And from Thursday, and then on a weekly basis, NHS England will publish a more detailed breakdown of vaccinations in England, including by region. Madam Deputy Speaker, this continues to be a difficult time for our country, for our NHS, and for everyone as we continue to live under tough restrictions. But we've always known that a vaccine would be our best way out of this evil pandemic, and that is the road we are now taking. We're under no illusion as to the scale of the challenge ahead, the distance still yet to travel. In more normal times, Madam Deputy Speaker, the largest vaccination programme in British history would be an epic feat. But against the backdrop of a global pandemic and a new, more transmissible variant, it is a huge challenge. Yet, with this House, and indeed with the whole nation behind this national mission, I have every confidence that it will be a national success, and I commend the statement to the House.
Thank you. Alex Norris.
Thank you, Madam Deputy Speaker, and I'm grateful to the Minister for advance sight of his statement. Now, we meet today at a very challenging moment in handling this pandemic. We have growing infection rates, we're in lockdown, businesses are shuttered, schools are closed, and tragically, more than 80,000 people have already lost their lives to this awful virus. And the vaccine provides us with that light, that glimmer of hope, and provides us with a way to beat the virus, saving lives and getting us back to normal. The government has succeeded with the development of a vaccine. Investing in multiple candidates has paid off handsomely, but a vaccine alone does not make a vaccination programme. And given the government's failures with the test and trace system and on the procurement of PPE, it is right that we scrutinise these plans carefully. Now, the plan itself is quite a conventional plan. Aside from the new big vaccination centres, it uses traditional delivery mechanisms operating within traditional opening times and access. As an opposition, we do have some concerns with this. We believe exceptional circumstances call for an exceptional response. 24/7 access. I know earlier today at the number 10 briefing that this was said to be something that people wouldn't be interested in. I was very surprised to hear that. I'd be interested to hear from the Minister his basis for that. But similarly, the mass deployment of community spaces and also a need for a volunteer mobilisation unprecedented in peacetime. Now, it's the government's prerogative to choose their approach, but I'd be keen to hear from the Minister assurance that this plan, as written, as constituted today, will deliver on what's been promised, those top 4 priority categories covered by the middle of next month. On a recent call, Madam Deputy Speaker, the Minister said that the only limiting factor on the immunisation programme would be the speed of supply. Will he publicly reaffirm that and confirm that this plan will make maximum use of the supply as he expects to get it? Now, I think we would all agree that our frontline NHS and social care heroes deserve to be protected. At the beginning of this pandemic, our staff for too long were left without adequate PPE, and we must not repeat this with the vaccine. Protecting them is the right thing to do to reflect the risks that they face, but also it's pragmatically a point of emphasis for us because we need them to be well in order to keep doing the incredible job that they're doing. We're currently missing about 46,000 NHS staff for COVID reasons. The health and social care workforce are category 2 in this plan, but there does not seem to be national level emphasis on inoculating them immediately, and there seems to be significant variation from trust area to trust area. Will the Minister commit today to meet our demand that they all get their vaccines within the next fortnight? And he talked, and we very much welcome the clear and simple metrics that he's going to publish each day so we can follow the success of the programme. But will he commit as part of that to publicising the daily total of health and care staff vaccinated so we can see the progress made against that vital metric too? It was very much reassuring, Madam Deputy Speaker, to see pharmacy included in this plan. They are at the heart of all of the communities in our country. They're trusted. They already deliver mass vaccinations. It was disappointing and surprising to see them have to take to the front page of national newspapers last week to get the government's attention. But now with them in the plan, will the Minister reassure the House that he's now fully engaged with their representative bodies and that they are satisfied that they're being used properly? The number trailed publicly is of 200 participating pharmacies. Given that there are 11,500 community pharmacies in England, can that really be right? Why aren't there more involved, or is that number wrong? And if so, could the Minister perhaps share with us what that number is? On social care, 23% of elderly care home residents have been vaccinated, and that compares to 40% of the over 80s more generally. Given their top prioritisation, is there a reason for this lag, and what plans are there to close this gap? And is the Minister confident that all care home residents will be vaccinated by the end of the month as promised? And then finally, on misinformation, this is something that's been, I think there's a